The Alberta government recently announced a significant change to how hospital surgeries will be funded. Instead of a lump sum of funding to be used however hospitals see fit, so-called activity-based funding will be tied to the actual care provided to patients. Hospitals with empty operating rooms would receive less funding, while private surgical facilities doing more surgeries more efficiently could receive more funding. Dr. Brian Day operates the Canby Surgery Centre in Vancouver, a private surgery provider. He recently lost a years-long court battle challenging BC's Medicare Protection Act as unconstitutional. Dr. Day joins me today. Dr. Day, thanks so much for being here with us today.
Oh, you're welcome.
Okay, so Dr. Day, just as a bit of a background, your legal case started in 2009 and went to trial in
Yes.
2016, right? And then finally ended earlier this year. So what were you
Uh,
challenging in court?
well, we were basically going to court to ask, 20 years ago, the Supreme Court of Canada had given Quebecers the right to private health insurance, especially when the public health system wasn't performing, but it gave them the absolute right to get private health insurance. Um, so we went to court to try and get the same privileges and rights under the charter for the rest of the country. And in their wisdom, the Supreme Court of Canada didn't want to hear that case, um, because they were politically afraid of the subject. And I think it's very important to understand. And this was evidence. We know this, but it was also evidence from an expert at the trial that Canada is the only jurisdiction on the planet, literally the only country in the world, where government has banned private health insurance as a safety valve for the public system. So we're unique in the world. It's bizarre. So not China, not North Korea, not Cuba, only in Canada.
That's fascinating. So then, Dr. Day, what would your reaction then be to the news that Alberta is moving towards this patient-focused or activity-based funding model?
Yeah, no, what they're doing, it's not really a public-private thing. It's really logical what they're doing. So uh, every OECD country funds its hospitals on what I call and what Alberta is calling patient-focused funding. When I was Canadian Medical Association president, this is one of the main themes that I fought for in Canada. And we are unique in that among OECD countries in completely funding our hospitals by giving them a lump sum at the beginning of the year. So, a large hospital might be given $3 billion a year. So that every patient that goes to that hospital is using up the hospital's money. In every other public system, it doesn't matter whether it's public or private, when the patient goes to a hospital in, say, England or Denmark or New Zealand, when a patient goes to the public hospital, they get funding by the government for their procedure. So the end result is that an administrator in a public hospital in other countries wants patients, because without patients they don't have revenue, whereas an administrator in a public hospital in Canada, the last thing they want is patients, because they use up their annual revenue. It's bizarre. Like, imagine going to a grocery store where the last thing the grocery store wanted was for you to pick up any items because you were using up once that you took them, that was their money gone. I mean, it's actually the most bizarre thing. And it's one of the ways to improve the public system. That's been proven. It was proven in England under Tony Blair, a Labour Party leader, and it's been proven worldwide.
That's interesting. So in your opinion, where would they rather put the funding if
Well,
not to patients?
well, you see, the problem is it's much easier for a hospital to not have to serve patients, and the same applies not just to, say, going for a hip replacement. It applies to going into the emergency department. So you go into an emergency department in say England, the hospital, public hospital, gets revenue from the government for the public patient. Here, again, the patients are using up the revenue, and that's partly explains why we have massive lineups, and waiting lists, because the administrators, the last thing they want are patients. It's bizarre. And we fought for that, so in 2008, that was when I was president of the Canadian Medical Association, that was one of our main themes. And it's been dabbled in by a few provinces, but there's a big problem with it. And the big problem is this: we have let millions of Canadians become, um, lining up on wait lists to get into hospital. If you suddenly introduce patient-focused funding, which is based on funding per patient, it's going to incentivize the hospitals, which is good. But then the problem is there's a big unfunded liability that it's going to cost a lot to get rid of the initial wait list. But in fact, the other important point is that in Canada, and we proved this again as when I was CMA president, it's actually cheaper to keep people, to treat people quickly than it is to keep them on wait lists. Because when you put someone on a wait list, they tend to deteriorate. And as they deteriorate, their medical issues often become more complex unless you're one of the 35,000 Canadians who die every year on
Right.
wait lists.
So, Dr. Day, really quick. So, this type of funding model is obviously being used in other parts of the world, as you've said. So, what have we seen in terms of wait times and outcomes in those places?
Well, I'll give you a quick anecdote. I had a visiting surgeon from Germany, where 90% of the public in Germany have public health insurance and 10% have private health insurance. And as a kind of, I knew the answer because I've worked over in Europe. And I said to him, well, someone with a hip or knee replacement, how long do they wait in the public system in Germany? He says, oh, it's a long time. I said, well, how long? He says, oh, maybe 3 or 4 weeks. And and he said, and in the private system, they only wait 1 or 2 weeks. So this is the thing. By introducing some competition, you improve the public monopoly, because without competition, nobody knows anything better because we aren't exposed to it. And it's well known, it's almost a rule of nature that monopolies do not serve consumers well. They don't need to, because there's no choice anyway. And that's what we have in the provision of healthcare for medical, for surgeries that are designated as publicly necessary.
All right. Dr. Day, thanks so much for joining us today.
Oh, you're welcome.
Now, on the flip side of this issue, this new funding model has been met with criticism from other groups, including Friends of Medicare, which calls this decision another blow to public hospitals. Chris Gallaway is Executive Director for Friends of Medicare and joins us now. Chris, thanks so much for joining me and being here today.
Yeah, thanks so much for having me today.
Absolutely. Okay, so Chris, you call this type of funding a voucher system. So maybe explain that for us first.
Yeah, it's a common approach we've seen from governments looking to privatize, looking to pull apart public services, where you have the money follow the student or the patient or the procedure rather than funding facilities and institutions to do the work that's needed. And it really opens the door to create a market for private for profit providers to now get public dollars to do some of the work. So, we've already opened that door in terms of surgeries with funding of private surgical centers that are for profit centers. But now there's this new model that means they'll be able to push through volumes and to make even more money while undermining our public hospitals' capacity to provide those same services.
Okay. How do you respond then to the premier's contention that because hospitals get their lump sum of money for procedures, there's no accountability and no incentive to meet targets?
Yeah, we've seen this talk about accountability. The government's really turned to blaming Alberta Health Services for any issue in healthcare right now. They've chosen that as a political strategy. But the government controls Alberta Health Services. They've fired the board, they fired the CEO. They're actually directly in control of the whole healthcare system right now. So whatever outcomes are happening are results of the government's leadership and decisions. They've made a decision to fund private for-profit surgical centers and not increase funding to public hospitals. They've been doing that for years. And the result of that is the capacity in the private sector has grown and the capacity in the public sector hasn't, because their funding hasn't kept up with population growth or inflation costs. So of course that's the result. It's not because of some nefarious Alberta Health Services plan to not provide surgeries. It was a choice of the government of where they funded surgeries and healthcare dollars.
Okay. How then would you respond to studies showing positive results with this funding model, like places like Quebec and some European countries, and I think even Australia?
Yeah, so the government has pointed to other jurisdictions like Ontario or BC. BC actually reversed this model because it wasn't working. If you look to Australia, they've had some major problems with their private hospitals. During the pandemic, those facilities actually threatened to close if the government didn't give them money to stay open through the pandemic. They're also struggling right now. So there's a lot of examples to look at where this doesn't work. You look at Ontario, where they're paying 2 to 3 times as much for the surgeries in the private centers versus the public hospitals. It's a very expensive approach that has been tried in many jurisdictions and usually abandoned because the cost of it isn't worth doing.
What about the volume of surgeries performed? Couldn't they get to more people faster?
Creating a new facility doesn't create new surgeons, anesthesiologists, nurses. It actually blows apart our workforce. If we were serious about shortening wait lists, something the government claims this agenda is about, but so far has not succeeded in doing through this privatization approach, if we were serious about that, we would open our operating rooms more, fund them to do more procedures, longer hours. We could also do innovative things like have specialized operating rooms in the public system for knee and hip surgeries if that were a goal. They've chosen at every point to only fund more private surgeries and not actually fund our operating rooms to be fully open and at capacity.
It's interesting because Quebec moved to this type of, model, I guess, targeted funding in, was it 2004? And there's been a Canadian public policy think tank, MEI, releasing the research from there, and it showed that by 2012 and 13, that year, it had significantly increased the volume of surgeries performed as well as decreased the wait times and lengths of stay. And it looks like similar results were shown in other countries like Australia.
Yeah, so when you look at those things, it's very hard to compare with other jurisdictions sometimes, like Quebec, because how they do healthcare fully is different. How their hospitals are owned and operated. They have requirements for employers to provide health benefits that we don't, and other pieces. But if you look next door to Saskatchewan, they had the Saskatchewan Surgical Initiative. We have the Alberta Surgical Initiative modeled after that. When they did this in Saskatchewan, they paired it with a huge investment in public hospitals and public operating rooms. And that is why they saw a decrease in their wait times. They got more surgeries done. As soon as they ended that extra funding for the public hospitals, their wait lists are as bad as ours now. And they're looking at sending patients to Calgary. It's fully about decisions around capacity, workforce, and the number of procedures you're going to fund. It's not about the privatization suddenly reducing wait lists. That's never been true when you look at other jurisdictions. It's decisions about funding. It's decisions about how many procedures you're going to get done. It's decisions about the workforce to ensure you actually have the surgeons and nurses and other workers you need to do that, which is our biggest struggle in Alberta right now in healthcare, whether surgeries or any other procedure or facility. We don't have the skilled healthcare workers we need to keep things going. And that's what we should be focused on.
So if you are against this type of funding, what's the best solution, do you think?
We were calling going into the provincial budget that we need a plan for capacity and workforce for the system to actually look at the whole province, look at healthcare. Who do we have? How do we retain them? And then what skilled healthcare workers do we need to recruit and train to actually provide service across the province to Albertans? So we're not seeing long waits, closures, and gaps in care. That's the approach we would like to see. Actually map it out and do that work, and then make your decisions within that framework. Instead, we've seen one-off announcements of surgical funding, one-off announcements of other projects that aren't connected to an actual plan for how we're going to provide healthcare to Albertans and have the workforce we need to do that.
Chris, we appreciate your time today. Thanks so much for joining us.
Thanks so much for having me.
Chris Gallaway is Executive Director of the group Friends of Medicare. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks so much for watching.